May is also National Asthma and Allergy Awareness Month. The number of people with asthma in the United States continues to grow. 1 in 12 people, or about 25 million, had asthma in 2009, compared with 1 in 14, or about 20 million in 2001. Ed Neuzil, registered nurse practitioner at Allergy Sinus and Asthma Family Health Center, explains how asthma and allergies often go hand in hand.
A great majority of the people that have allergies do have or develop asthma. Okay, so you may start out with a runny nose, but somewhere along this lifespan, you may notice that you're starting to develop the bronchospasm, because over 10 years ago, they looked at this being as a united airway disease. So the inflammation that occurs in the nose also occurs throughout the airways, which includes in the lungs. So that inflammatory process is what would be triggering asthma. Now, you can have a stuffy nose and maybe not have as much obstruction, so you're not feeling those asthma symptoms, but if we were to do a spirometry to look at your pulmonary functions, you may actually see that obstruction, and then by giving you a little bit of medication, we can see that reversibility. That is an asthma type condition. When we look at asthma, we're looking at the transport. What gets the air from your mouth, your nose, all the way out to where you breathe. So it's merely a transport. When we look at asthma, we're looking at obstruction of that transport line. So obviously, if you're trying to fill something, you want a bigger hose than a smaller hose. And asthma gives you that smaller hose. Fortunately, with asthma, we have, because it is a reversible airway obstruction, we have medications similar to albuterol, which is called a short-acting bronchodilator, that helps us reverse that obstruction and give us a bigger hose.
You'll find contact information and more about allergies, allergy testing, and treatments at the Allergy Sinus and Asthma Family Health Center in Lady Lake when you visit the Asthma and Allergies story link at yourhometownhealth.com.